Welcome to another episode of Health Your Way podcast, where we discuss health issues ranging from physical, mental, emotional, as well as current fads. Today, we're going to be talking about COVID-19, and let's talk about it. And we hear a lot of news, social media, Instagram, and we don't really get to hear about what frontline workers are dealing with. And today, my special guest is a nurse by name of Jeanne. She's a registered nurse, been in the industry for over 10 years, and is currently dealing with the COVID-19 patients in her unit. And I'm extremely excited because I've always wanted to talk to people that are dealing with this heads on and get their view. So I would like to say, Jeanne, thank you for joining me. I appreciate you coming. How are you?
I'm great. Thank you for inviting me, Mo. So
Yes.
I'm Jeanne, one of the nurses who is actually working in the front line at a hospital right now.
Yes. And again, just for disclaimer, this is her opinion. We're not representing any doctor, any physician, or any association. It's just really having a candid conversation with her and just getting her opinion. Again, her opinion. So for our viewers and listeners that are listening or watching as well, is what type of nurse are you, and how did you become involved in the fight against COVID-19?
So basically, I usually work on one of the floors at the hospital, and there's just one day that the hospital sent out an email saying we need volunteers who are interested in working on the COVID units, because as we know, a lot of people were traveling, either they're off sick or they've traveled and needed to be quarantined. And there was that time where there was a lot of uncertainties really going on, and people have the fear as well of what's yet to come, or they just don't know what's going on as well. So in terms of that, obviously, as many of you heard before, healthcare is always short staffed, and that is there ever funding to provide more staff to care for the patients that we have. So basically, that was when I wanted to do more, either for myself or for the people out there as well, what I can do during this time.
Like, I don't think people realize, even when you're saying this to me, I'm just shocked, because a lot of people are not that selfishness, right? Because again,
Right.
there was a lot of uncertainty, so you're not even sure how much risk you're taking. Like, because you volunteer, how are your friends and family, like, how did they react when you did that?
So actually, my family is pretty supportive,
Oh,
and
good.
I guess my sister will be like, my sister just had a newborn as well, about a month. So I told her right away, I'm
Congratulations.
gonna stay away. Thank you. I told her that I will stay away from her for a little while, which is call each other as well. Um,
Yeah.
and yeah, that's friends. In terms of friends, they understand. I have a few close friends that they they know the importance of right nowadays is social distancing, and
Yeah.
and that we both have our own families that we take care of as well. So
No, I get you.
for
Like,
sure.
I think for me, if I volunteered, I would have been like, this is me personally, I would be scared. I think my family would have been worried about me, but I think, as you said, they'll be supportive because they're hoping that if they were ever in that situation, somebody like you from another family member
Hmm.
would volunteer and help out. So it's like helping out, we're all one people trying to help each other out, not thinking about ourselves only. And you are, everybody keeps saying that you guys are you guys are the heroes. And when it comes down to it, it's not being heroes, it's just being a human being, right? Like, really.
Right.
Yeah. And I respect you for that, because when you told me that, and when I'm hearing it again, it's just not a lot of people would do that. And, I commend you. Like, you're a good person. Sorry. I just,
Well, thank you. But I think I guess it's not just talking about speaking on my behalf as well. I think a lot of nurses, they do their best of what they can as well in
it's
terms
true.
of helping out. There was quite a number of volunteers that I came across, and some are just gonna even be there. They said they were gonna be there on a permanent basis until this is all over. So
Wow.
I see that too, being full timer there as well. And it's not. I guess it's not just nurses, even people who are even physicians, all the staff at the hospital, people who are even cleaners, in the hospital.
Yes.
I think they are at at risk as much as we are as well, right? And I don't think it's just a hospital setting as well. It's every industry, even people out there at the restaurant, serving takeouts and even deliveries, and even TTC workers that we always seem to neglect for some reason, all the service industries out there as well.
You
For
know
sure.
what? I appreciate that. I think for me, again, you might be right. Like a lot of people don't realize that other people that actually leave their house every day to go to work just to make the industry go, we don't realize that we hear what's on the news. And with that being said, we watch a lot of news and we sometimes, as you just mentioned, we don't really hear what the frontline workers are dealing with. So I guess for some of our listeners and viewers, what are some of your daily struggles or at home and at work that you can share with us on what your life is like and how different is it from before COVID-19?
I think for myself that actually it doesn't bother me as much because usually it's just I believe it's just a perspective of things, right? I mean, it's not that I'm saying not to take this lightly. At the same time, it's not to have that too much of a fear as well, because sometimes I feel like fear can obscure a lot of our judgments.
I agree with you.
And that, you still have to carry on with your lives. Either it's just a different way of doing that right now. You're not going to the gym anymore, do a home workout, right? Some ways to fulfill yourself in other senses that, it might even help to break out old bad habits you used to have, right? Maybe people are starting to cook more at home, or, well, some people are taking out deliveries. But
I get you what you say.
Just it's a good time to, how to improve yourself and just how to pick up on good habits. And the social distancing, I think also, you might not get to hang around and see your friends as much, for example, but at the same time, I feel certainly for some families that it brings them closer as well in terms of the family dynamics.
So then, with that being said, with social distancing, there's an importance, like we always hear, why is it important to be social distancing? How does that help you guys with your fight? So you kept saying, but you said previously, like it helps with, family dynamic and also could help us fight this COVID-19. That's what I'm hearing. Do you disagree? What do you think?
Well, in terms of social distancing, for sure that, that's what research is, and I'm not here to offer any medical advices or anything, but if they have stated that social distancing, especially, you never know who is a carrier of it. It's not, sometimes people might carry it and they don't have certain symptoms, but it's not a reason to fear them. But at the same time, just be smart about that as well, right? Because if you don't keep yourself within the distance from some people, you might bring it home to your
I get what you're saying.
family, in terms of the elderly population, especially because they are more susceptible to that in general, with a weaker immune system in general to begin with. So
I agree with you in that, because you said, like, social distance is important based on what we've been hearing from everybody, from medical experts and stuff like that. And what I'm getting from you is you're stating that it is important, but keep in mind that it doesn't mean that you isolate yourself altogether. You just make sure that you play safe. You do the recommendations, and we're not recommending anything. It's our opinion that you not should be afraid of people. You should just be self-aware of what's around you and be safe, because you never know. And
exactly. You summarized it pretty well. Because so far as researchers go, it's basically saying it's transmitted by droplet and contact. So basically, if you're in a close system with someone, and there's new research obviously saying, okay, it lingers around in the air for a certain amount of time, but if you're at home with your household, you're not going to distance from them. You're not each going to get a house and try to isolate yourself that way. It's just logically what makes sense, right?
Yes, I agree with you. And to add on that, a lot of people, we hear a lot of news and just so much information out there. And you see on Facebook, Instagram, you hear about certain, cures out there, putting hot water down your throat. Like, I've seen it all. And I think for a lot of people is, in your opinion, like, where should they be looking to get that the right information, the accurate information, besides really relying on Facebook shares or Instagram posting?
So Mo, I don't know if you've been recently getting maybe on WhatsApp, no, people forwarding messages. It's like,
I
oh,
hate that.
COVID-19 affected affected
So
this
much.
population today. Yeah, I've been getting those a lot, right? From not just Toronto, but all over the world. Because I have some
Really?
relatives. I mean, I
Okay.
have some relatives outside of Canada as well. So you see, yeah, you see people forwarding, and then people making a lot of posts. So there's a lot of notifications through Facebook every day just talking about that, right? Even in Facebook Messenger, you get those sent. Um, I honestly, I ignore everything except for the things I see on a credible resource. It's just like on the Canadian government's website, they
Okay.
provide a lot of information on there in terms of traveling, in terms of watching out for symptoms, and just what you can do to prevent further transmission, right? And also, a good place to go to is also either on hospital websites or, yeah, just mainly.
Don't rely on your best friend sending you forwards that were sent through WhatsApp app or some general person. We're basically, and she's basically saying, go to the government website, go to like the WHO, like WHO, like just educate yourself. Don't just forward, I'm sorry, stupidness out there, because some of it is really utterly stupid. I'm sorry.
Right.
And that's my opinion. Like
agree.
I've seen things, I'm just like, okay. And I guess at this point, I appreciate you taking the time, and with so many uncertainties that are currently in our reality, and for the general public, what can we do to assist frontline workers in the fight against COVID-19? Like, how can we help you guys going forward to maybe help you guys get back to normal?
You know what? A lot of people and places in general has been pretty supportive of what we do. So I heard stories that from other nurses that some businesses are dropping off stuff to the emerge nurses at the hospitals, and people are the hospital is looking for donations, right? So basically, uh, well, depending on what they're looking for, to donate as well. And a lot of businesses were supporting. I guess I'm not going to name any, but it's pretty much easy to find on a website that has been supporting in terms of giving out free food or discounted food or footwears for nurses or for any healthcare workers as well.
Oh, I didn't know
So
that. That's good, because I don't think I've heard that on the news. Maybe I don't watch that much news, but I guess what you're saying is like whatever you can do that is going to help, that you feel like can help the nurses, or you can do something as well internally. Like, we're not asking for anything specifically, but feel free. That's what I think. That's what I'm understanding.
Yeah, and I know that's all this social isolation is hard for probably a lot of people. And I learned from someone that sometimes we have to keep in mind that we're all going through the same storm, but at the same time we're not all in the same boat. Where some might treat this as a little vacation, mini vacation, where they get to stay at home, and yeah, and basically, oh, I get to work from home, and that's good as well. But keep in mind those that those who have who are laid off or lost their jobs as well, and just struggling to pay bills in general as well. So
I agree with you on that. And with that being said, I don't want to take your time, because I know this is your day off and you're a very busy woman. And as just to leave it off, like, again, we're not talking on behalf of any association or any hospital. This is just a candid conversation with Jeanne, and I really, again, appreciate you taking the time, because we don't really get to hear your stories, or people that are dealing with frontline workers, nurses, doctors. You mentioned people that do the cleaning, stuff like that. We don't really hear the story, and I appreciate you giving that small feedback earlier in our conversation. And I think at this point, thank you for taking the time to talk to me. I'm actually very honored, because I know I really appreciate it. And yeah, we're done. So
thank you very much, Mo.
You're welcome. Thank you for joining us today on our weekly episode on Health Your Way podcast. Don't forget to subscribe, share with others, and please feel free to comment below and ask any questions on topics we've discussed, as well as future topics you'd like to hear about. Have a happy and healthy week, and be sure to tune in next week for the next episode on a Health Your Own Way podcast.